Well, some people are choosing to take COVID-19 treatment prevention into their own hands rather than relying on doctors' advice. WDRB's Travis Ragsdale explains why people are turning to a drug normally used on livestock.
And if somebody asked for Ivermectin, I personally would say, I'm sorry, I'm not comfortable with that.
Dr. Hugh Schoaf is the Associate Chief Medical Officer at Louisville Hospital, and he has a very clear message.
Ivermectin does not treat COVID. It does not prevent COVID. It does not treat the symptoms of COVID.
Nevertheless, ivermectin is flying off the shelf, but you're more likely to find it at a farm supply store than a CVS or Walgreens.
Really, the main use, as people know, is for horse parasites.
Interest in the drug has soared as the number of COVID cases has done the same. It's only gained steam in various Facebook groups and on Reddit. But as far as actual science and research, there is none.
Right now, there's no evidence whatsoever that this can treat COVID. What we do know is that it can harm people.
In fact, the number of calls about ivermectin overdoses to poison control has increased fivefold over the past few months, according to the American Association of Poison Control Centers.
If you take some of the high-dose ivermectin, they become confused, they have altered mental status, they're not thinking the same way, it affects the nervous system, it can affect the GI tract.
Ivermectin has been tested for other uses in humans, though.
It can be used on a rare occasion in humans as a parasitic infection to kill a parasite. Parasites are completely different than a virus.
But for COVID, Schoaf says it's a big no-no.
We have studied these vaccines in humans with COVID. Ivermectin has not been studied whatsoever.
Travis Ragsdale, WDRB News.